today for the conference committee. And, you know, is it fair to say that there's a lot of work to do? Because on the surface out here in media land, it looks like you're about as far apart starting the negotiations on the budget as we've ever seen the Senate and House be.
Well, I think we need to go back and realize where we are. We're in the middle of a 2-year budget. The fact of the matter is, if we didn't pass a budget, we have one that's working, that the governor's doing a good job with. He actually did such a good job that he was able to take money that we were going to spend in this year, save it so that we had a little bit more availability for next year. So in reality, we don't have to have a budget. What we're trying to do, and first and foremost, what we have to do is fulfill a promise that we made back in February, Senator Berger, myself, and the governor, to provide the raises to the teachers to get our starting pay up. Now we've found we've got a little bit more availability, so we can do more for the veteran teachers. But really, outside of that education and some technical adjustments for health and human services, we can make this a lot narrower discussion than I think some people would believe. I think it's also good that we are very close. The governor likes the House budget. We embraced a lot of the provisions that the governor put forth, and I will add a lot of the provisions that the Senate did. My goal will be to just eliminate the areas of controversy. If that means we have to wait until the long session to take them up, we can do that.
You know, the big news, of course, this week is the fact that the House budget, when you put that forth a couple of weeks ago, we heard that you were counting on additional lottery funds because you were willing to advertise. We were just talking to Senator Brown about that, who owns car dealerships and advertises with my radio stations down, by the way, down at the coast. You know, advertising does work. So you're hoping that it will increase the lottery revenues. But this week, a lot of concern has popped up. The projections that the House has put forth might not be realistic.
Well, you know, I think that we consulted with the Lottery Commission. We asked them what they thought was realistic. That's what we put in there. If it's not, if they've gone back and they don't think that we should count as much on it, then there are other ways for us to fulfill the promise for giving the teacher raises without using the lottery proceeds. I also want to compliment Skip Sam for getting the Honest Lottery Act provisions in there so people really know when they're buying a ticket what the odds are and what the payout will be. But I think a lot has been made of that, but the reality is we can fulfill the promise we made to teachers. We can do the pay raises and not necessarily have it rely on those lottery funds, which is about $100 million, just a little bit over. I actually think that we may be able, if we do that, we can reserve some of those funds we expect to see from the lottery for other things to do good for education.
We have some real concerns in eastern North Carolina. You saw Dr. Herman there a second ago when he was up with us. We had Senator Harry Brown in here. There are some things, particularly in the Senate budget, that could do some significant damage. It's already done some damage. The debt set-off, the ability to collect bad debt, which Senator Brown just talked about being a question of fairness for hospitals across the state. We tried to educate folks to make sure they understand that the Brody School of Medicine does not own a hospital, and yet there still seems to be a lot of concern about a fairness issue. You, on the other hand, have been very supportive on that, and I want to thank you publicly for that. And you know, we just had to ask Senator Brown straight out if it was going to be an item that would be they were willing to negotiate in the conference committee, and he made it sound as though there might be some room for negotiation on that. What kind of optimism can you give the Eastern North Carolina folks on that?
Well, you know, first I want to thank Dr. Herman, ECU, Vidant, and all the folks that are doing incredible things out there. When you look at a lot of people that are low pay, no pay, a fairly poor area, or they reach out to a fairly poor population, they do wonderful work. It's one of the reasons why I've tried to make it a priority. I'm not, you know, I hear what's being said about fairness, but I think if you look across the state, it's not one size fits all. There are variations of systems and the challenges that they have. I actually think that we should be able to get the set-off done. Now, I'm encouraged because I spoke with one senior member of the Senate yesterday who said they're working on something that'll solve the problem. I don't know if it goes as far as I would like to. We'll look at it, but I think that that's promising. We're also still having the discussions about the upper pay limit, which I know is another issue up in your neck of the woods.
It absolutely is. Those are two big issues, and the Brody School of Medicine, you know, with all these Medicaid cuts. You know, the one issue, Mr. Speaker, that you've been supportive on that some people don't seem to understand is that when you leave Greenville and go out into the different areas of eastern North Carolina, we have abject poverty in a lot of areas, and those are the patients a lot of times of the Brody School of Medicine. So, you know, that's why Medicaid costs are so high.
That's exactly right, and that's why I think we need to work on this and get it right. You know, in the set-off issue, the concern that I haven't heard a lot of people in other healthcare systems coming and opposing this measure. So to me, if there was a groundswell of people saying it was unfair out there in the provider community, I may take pause with my position, but we're not hearing that. I think this is something we can do that is very helpful, and if we don't do it, very disruptive to eastern North Carolina's healthcare infrastructure.
I know you got to go back to work. I can't let you go without asking you about your U.S. Senate campaign.
Oh, yeah, that.
You got that going on?
Yeah.
You've got something. The rest of your summer will be spent wakeboarding with Parker Overton, right?
Oh, yeah, I wish. I am going to get out and wake surf or wakeboard once or twice this year, but we're running a great campaign. We had a great transition, a great primary. We exceeded all expectations for what we did in the primary. We've got a great level of support in North Carolina. We've got a great grassroots game. That's why we won the way that we did, because we've got volunteers and we've got people on the ground working. Kay Hagan's failed the people of North Carolina. Kay Hagan has failed military personnel. She has failed poor people. She has failed some of the poorest families that we're trying to give those parents the ability to take their children to private schools. She continues to say one thing and do another. Actually, we just created a website called penpalk.com, and it demonstrates the difference between the letters Kay Hagan writes and the policy that she votes on. I mean, and there's a very clear difference between what she says and what she does. You know, our state motto is esse quam videre, but she kind of seems rather than bees. She's not to be rather than to seem. She's just got the motto mixed up. And I think that that's going to harm her in November. We've got a great campaign. We're getting a lot of financial support, always looking for more, always encourage people to go out to votetillis.com, take a look at our campaign, what we stand for, and hopefully get their support.
Well, all these issues we're dealing with in eastern North Carolina relating to health care have a lot to do with people, the reality of Obamacare finally hitting us. But you know, what I see, Mr. Speaker, is widespread panic in the medical industry about what's going to happen 5 or 10 years from now, and that's what worries me about the whole Obamacare piece.
I worry about eastern North Carolina. I worry about the rural areas of the state, because government-run health care is a bad idea, and ultimately government-run health care is going to harm the most at-risk part of our population. I have no doubt about that. If I thought it could provide a better value, but I think our access is going to be more limited. I think that the sickest people are going to be the most at risk, and it's just a bad solution. They came up with a solution. There is a healthcare problem out there that we need to deal with, but we don't need the cost and complexity of Obamacare, which is going to make the matter worse. Look, we've got some of the highest premium increases of any state in the nation. That's why it continues to be unpopular in North Carolina. We have one of the highest numbers of policy cancellations. We have Kay Hagan saying 22 times, if you like your doctor, you can keep them. If you like your policy, you can keep it. That's been proven to be false, and it's a real problem in this state. And I think in November it's going to be one of the major factors why I'm going to be the next U.S. Senator from North Carolina.
Speaker Tom Tillis, potential future U.S. Senator Tom Tillis, and this is going to be an interesting year for you. I have to say publicly, Dr. Herman is still here, some of the hospital folks. I have to thank you publicly for the incredible support that you and Governor McCrory have given to the Greenville region, eastern North Carolina. We need you right now. This is a critical moment. We were talking about, I told Dr. Herman the other day, it looks like we're at DEFCON 2 on some of the funding issues. I think what we're facing is a potentially transitional change in our economy if some of the things are not dealt with in the right way to help eastern North Carolina right now.
Well, we're going to go out there and keep fighting for you. I think that I have as Speaker for the last 3.5 years. The next week or two, very important. Dr. Herman, a lot of people out in eastern North Carolina are very well regarded in the legislature. Y'all need to be down here with us in these times and really get the message across so that we do the right thing for folks out in eastern North Carolina and across the state.
When do you think the session will end? Do you have a projection right now?
I think June 20 or June 34th.
Is that July 3rd?
Right about that time frame.
Are you going to be out of here by July 4th weekend?
That's what we're targeting. I think that we can. Certainly, all the other matters except for the budget should be settled by then. And frankly, if we can't come to an agreement with the budget over the next week or so, I strongly believe we ought to just go fulfill the promises that we made. We can do that without renegotiating the entire budget, and that's something the House is prepared to do if necessary.
What does that mean?
That means
since you opened that door, what does that mean?
That means that we've got to fulfill the promise that we made to teachers. We have got to increase starting teacher pay to where we get it to the national average in 2 years. Regional average next year with a 7% increase, national average the following year with a 7% increase. We have got to fulfill the promise to the veteran teachers. We've also got to listen to the superintendents who have some concerns with the practical problems with policies that have been passed, that we can make some adjustments, make it easier to do their jobs, whether it's school grading or other things. But you can do that without passing a budget. We can fulfill the promise of paying teachers and increasing state employee salaries without passing a budget. We just pass an appropriations measure and let it go forward. We can do the same thing with some of the health care provisions. So I want everybody to realize in a short session, we're here to adjust things, not to create a new budget. And if we're not able to get that done in conference over the next week or so, I think we have to have a serious discussion about what minimally we have to do to fulfill the promise and not disrupt what the providers, health care, and educators are doing in this state.
Well, there's a lot of work to be done, and you've got a short time to do it if you're going to try to get out by July 4th weekend. So I'll let you get back across the street and get to it. Thank you for coming over this morning.
Have a great.
We'll see you in Greenville next week. I understand you're going to be spending some time down east next week.
I'm looking forward to it every time I get down there.
Yeah, good to see you. Speaker Tom Tillis, the Speaker of the House. Good to have you with us this morning, and we'll talk to you soon. All right, we're going to, that pretty much concludes what we've got. We've got all of our interviews in, so I'm going to throw it back to the station and get some news and sports headlines in just in a couple of seconds. But I do want to thank Scott Shook, one of our sponsors of the morning show. The weather and news most mornings brought to you by Scott Shook and his partner Thomas Rouse and Linda Poff at BB&T Scott and Stringfellow. For more than a century, BB&T Scott and Stringfellow has been providing comprehensive, customized investment guidance to help our clients reach their financial goals at BB&T Scott and Stringfellow. And now Scott Shook, Thomas Rouse have made the move to BB&T Securities, Scott and Stringfellow, to set up an appointment, talk about your financial concerns and future, maybe talk about some investments. Give Scott a call at 321-7808, 321-7808. Scott and Stringfellow, BB&T, a division of BB&T Securities, LLC, member FINRA and SIPC. Special thanks to Secretary John Scavarla and his staff, Drew Elliott. Did it again, Drew, I'm sorry. Drew Elliott, who works with the Secretary. Thanks to Josh Elliott, though, also the Communications Director for the Governor. And thanks to Senator Harry Brown, Representative Brian Brown, all the people who were on with us this morning. Another great show here from the legislature. We do this every year now, part of our coverage of what goes on in Raleigh. And I need to thank also Michael Buscemi, our producer, who got up early this morning, got in here. Chase, the famous Chase, is here, thanks to his help this morning. And a special thanks to our sponsors, Vidant Health, Dr. Herman, and the folks from Vidant Health who stepped up to be a part of this. Also great to meet Jay Briley this morning, the president of Duplin Vidant Health organization down in Duplin County, and also to Potash Corp Aurora for their sponsorship.